Welcome back to Bloom. Our next guest has been working on the front lines of COVID-19 in both Puerto Rico and New York. Joining us is Dr. Jaime Salas-Rushford, here to offer insight on what's working with flattening the curve, plus provide immune-building insights as we have just reopened Florida. Welcome, doctor. How are you?
Thank you. Pretty good. Thank you for being here.
We're so glad you're here. First of all, thank you for the work you and all the healthcare heroes are doing. But I'd love to know the differences that you noticed working both on the front lines in Puerto Rico and New York.
Well, the biggest thing is New York is far ahead than anybody else, right? It was the epicenter way before. So we're learning much more things in New York, and everything is lagging behind. So now that the trick is how other states in Puerto Rico can learn from the history of the pandemic in New York, and we can apply that knowledge in other states, cities, counties, and actually try not to commit, involuntary mistakes or omissions that are bound to happen on a pandemic this magnitude.
And for you, working in both those places, especially early on, how were you protecting yourself from the virus?
Well, I was in New York for 5 weeks. I just flew, if you look at me a bit tired, I just flew last night into Puerto Rico back again. So I'm seeing my private clinic now. So it's been an ongoing thing. Everything in my end has been negative. So all my tests have been negative. So it means that, PPE, self-protection, isolation when I was outside, trying to avoid direct contact and not being, so in top of patients and using my mask and gown, and everything worked. So it does work if you follow everything to the cent. Of course, every so often need to drink water. One of my nurses actually got sick, and his theory was that he needed to drink water to keep hydrated, and he removes his mask every so often in a high risk setting. So unfortunately, he got very sick and got positive for COVID. So, but again, I think social isolation, adherence to PPE, even though it's bothersome, even for me, you have your nose, your face all scarred up at times, but it has to be done.
Well, we're glad that you are doing well and able to continue to see patients. Immunity is another thing that we're talking about a lot. We know that vitamin C helps. What else might you recommend for people out there wanting to support that immune system?
So a little background so people understand. Really, when they say there's no cure for the virus, there actually is one cure treatment. It's our own human body. So everything that we do as physicians is to gain time for the body to actually do what it does best, fight the virus, the bacteria, whatever it needs to fight, right? So most of the things we do is symptomatic with supported treatment, either from controlling the fever or putting a patient on a ventilator is gaining time for the body to do itself. Now, we need to have a strong body in order for it to fight whatever comes, in this case, COVID, right? So like you said, vitamin C, one of the things in the hospitals, we ran out of vitamin C, is zinc. So we're using HCC, we're using selenium, HCC, a supplement that has been greatly studied in Japan for the flu. So we're trying many different things. That's one I use myself, obviously, and I gave my dad. And ironically enough, my mom did get COVID. My dad didn't. He was taking that, and my mom didn't. So it was one of those little things that you see as a physician and start to wonder what works and what doesn't work. But good sleep, good nutrition, your good supplements, and also adhere to good guidelines, meaning go to trusted websites like the Vitamin D Society, the hcc.net, things like this that you actually get real information. Don't go to blogs, don't go, people injecting weird stuff in their bodies. That should not be done. Everything should be done under supervision of your clinical physician or healthcare provider.
Yeah, that's very interesting about the HCC to know about that. One other question before we wrap. Florida is just beginning to reopen. We're here, phase one. So what should people be doing, and how should they be approaching this reopening?
So, New York is also starting to reopen in some parts. I've been lucky enough to be in the epicenter, so I'm looking as things unfold in real time. Puerto Rico is opening again. Social distancing is the key. Wearing the mask is the key. Everything else, has its debates. But if you adhere to social distancing, if you practice good hand washing, hygiene, and just basic common sense, this is a pandemic of basic two things: being knowledgeable of hygiene, basic hygiene, and also being courteous to your fellow human beings. This is taking care of somebody else by wearing your mask, keeping social distancing. So everything comes down to very basic information. If we can it's better to do a few things very, very well than to do many, many things the wrong way.
Well, we appreciate your time, everything you're doing, and that great advice. For more information, you can visit fitbodymd.me. Thank you so much, doctor.
Thank you.